So again, the name of the title of our call tonight is The Power of Six. For those of you who've never been on our call before, we have a simple, duplicatable system of enrolling 6 partners in order to maximize the binary plan and matching bonuses. But much of this is mindset. And therefore, we talk about things that are going to help us grow every single week on this call. And the compensation plan that we have right now is based on the fact that you can reach the top of our company if you duplicate yourself in increments of 6. And so this is why we came up with the power of 6. Now, what I want to talk about tonight, though, is something that has been really, I've been thinking about a lot. The night's title is called You Were Born Rich. And this is Dr. Bob Proctor, who is a well-known motivational speaker. He wrote a book. I happen to have downloaded the book, and you can download it as well, a PDF, and it's free. And it's called You Were Born Rich. And I took an excerpt out of this. And let me just talk about this. You know, many times we're thinking, why am I not achieving what I want? Why is other people around me reaching goals? Why are they doing certain things? And I'm not able to do that. I have not done that. And many times we don't think we're worthy. I mean, I'm not saying that's everybody, but sometimes we feel this way. But I want to read to you what he wrote in his book, You Were Born Rich. He says, in his preceding pages, he said, explained prosperity, properly understood, is simply the inward awareness of the opulence, wholeness, and completeness that abounds within the spiritual realm. In other words, it is impossible to feel poor when you're conscious of being enveloped in the protective care of a loving God, universal spirit, or whatever else you may wish to call this the spiritual center of our universe. Let me repeat, there never is and there never will be, there never has been any lack of supply other than that which we have created for ourselves because of our own limited awareness. It's in our spirit, in our mind, we're creating this limited awareness, but God, it does not come from God. And so I also want to talk about a gentleman that I met years ago when we were at another company. And Myron Golden is a business growth consultant. I knew him when he was not rich. He's worth about $25 million now. And in this that you're going to hear, I'm going to play a little bit of he does these YouTube recordings, and he says something in that recording. He says has to do with congruency and alignment. We talked about alignment on this call. And he says, if your desire is pulling you in one direction and your expectation is pulling you in another direction, your expectation is always going to win. A weak desire to achieve wealth will not overcome that expectation. You see, when you grow up in a certain type of environment and you're surrounded by people that have not been successful, you haven't seen anybody to go to college, you haven't seen anybody that became wealthy, you expect that you're not going to be wealthy because of the environment that you have been in. But if you have a desire to be wealthy and your expectation is saying another thing, they're pulling against each other. So what I want to do now, I want to pull up his recording. I want to show you, I want to let you hear, he can elaborate a little bit better than me. So if I can pull it up. And this training on this YouTube that he did is how to use scientific study to go from broke to rich in the shortest period of time. So let me go ahead and play some of this.
Somewhere in the middle? No? Okay. So let me ask you this. Who wants to live a really long time? Raise your hand and say me. Me. Okay, I want you to notice how much more visceral that response was. Why? When I ask how long do you want to live? If I were to ask how healthy do you want to be? Who wants to be as healthy as possible? Who? Me, right. Okay, nobody has to question that. So you want to max out in your life, you want to max out in your health. How smart would you like your children to be? As smart as possible? Yes? Okay. So you want your children to max out their intelligence. But when it comes to wealth, we have a little check in our spirit. Even though those of you who said yes, how many of you would be honest enough to say, even though I do desire to be wealthy, I kind of feel yucky or feel awkward or feel a little off admitting that? Anybody? Come on, let's be honest. Right. But where does that come from? I'll tell you where it comes from. It doesn't come, you weren't born with it. And do not make the mistake of thinking that it comes from God. Because it doesn't. You know where it comes from? It comes from the cultural hypnotic societal mechanism. Culture has programmed us to believe into buying into the idea subconsciously and consciously that there's something inherently wrong with desiring to be rich or wealthy. Now, you have to understand that one of the things that's necessary for you to achieve any result is a concept called congruency. What's congruency? It means alignment. What does that mean? It means if your desire is pulling in this direction and your expectation is pulling in this direction, your expectation is going to always win. And by the way, if you have a very, very clear expectation that's pulling in an opposite direction of a kind of weak, watered down desire, your expectation is going to win. So if you're expecting to be broke like your dad was broke, or expecting to be struggle like your mom struggled, or you're expecting to be broke because of your ethnicity, or you're expecting to be broke because of your education or lack thereof, that is your expectation, a weak desire to create wealth will not overcome that expectation. Is what I'm saying making sense? Yes. So, you don't have to desire to be wealthy, but you do have to decide whether you're going to desire it or not.
Ashton was a high-level athlete. She was even.
Now, let's get back to the discussion. You see, one of the things that I learned from Myron Golden just now was you have to decide. And if your desire, in other words, you got to decide that you want to desire to be wealthy. And the first thing, that Bob Proctor taught us in his book is it's not sinful to want to be wealthy. God is wealth. In other words, we're children of God, right? So therefore, we're already born wealthy. That's the reason the name of the book is You Are Born Rich. And sometimes as people associated rich just with money, you don't have to have a lot of the money to just be rich. You can be rich in your spirit, rich in your personality, but people pick up on those types of things. And so this is the point I want to make tonight, is that you want to, when you're talking to people and trying to close people, we say this all the time, people are buying you. So before you even open your mouth about what you're going to say, based on the previous experience that people have about you, that they know you, they already established a perception in their mind about you, like whether or not whether or not you're credible, whether how some people and something about them that's not attractive. Let's say they're an alcoholic or they're on drugs. You know what I'm saying? You have these perceived expectations that's going to come out of their mouth because you already know them one way. But I'm not saying that we're that way. I'm not saying that any of us on this call are that way. What I'm saying is, when you groom yourself to be excellent, when you groom yourself to be knowledgeable about certain things, stand up and be the leader that you're looking for your leader to be. When you come to somebody talking about this business, they've already established an expectation about you. And so what you want to do is make yourself, I have some notes here. What you want to do is make yourself non-essential to the transformation. In other words, don't spend so much time, we talk about the patch, we talk about this, that, and the other. Have you noticed many times, I know I say this in my presentation, I don't know if other people say it, but I think I've heard someone say it. We spend a lot of time talking about all the analytical stuff about the patch, and we need to do that, right? But sometimes you've got to just, that's why I love the testimonies, because the testimony is the proof of what's going on. See, so I've got some notes here. So your transformation has to be measurable before, like you know, someone that say this person had high blood pressure. That was before, but then after they don't have the high blood pressure anymore, right? And then the testimonial is the believable part. But some kind of way in your conversation with people, make sure that you get to the point. Take yourself out of the equation and give them the essence of the transformation so that they can gravitate to what you're trying to say. Don't come off as if you're trying to sell. So in other words, they know you as one way. Remember, people know you as one way, but what you want to do is take yourself out of the equation so that the information that you're telling them or trying to communicate with them takes you out of the equation. Therefore, you're going to win. They're going to listen to the results. So with that being the case, I just wanted to say that because so many of us, or I shouldn't say so many of us, you all know what is happening. There are many people in this company. Let's get back to LifeWave. Many people in this company that are really literally making 30, 40, 50, 60,000 a week. And I'm talking about people that have been in the company within the last 3 years. And we know we deserve some of that money too, but think about what I said earlier. Sometimes the environment that we grew up in, we are programmed to expect our outcome to be a certain kind of way. It's just an expectation. So what we've got to do is reprogram our minds and make our desire stronger than what we've expected. We expect certain things because we've always had it that way. We've always seen it that way. This is the only point I want to make tonight. Just develop your desire. I know one thing. I was talking to someone earlier. I think about this business almost all day long because I know that I really, really want it to work, not just for me and my family, but I really want to work. I want it to work for you all. This is why I'm always trying to find answers. And so many people are discouraged because they're not seeing the results of their efforts. So if you practice on your mindset and if you just have that desire, I promise you things are going to start falling in place. So what I've been doing this week, you guys, I have been, I had that recording that I did with the Power 6 where I show it's a 14-minute recording where I'm sharing the regular company presentation. And then I come back and let the person who's listening know that the reason you were invited to this call was because you're a visionary. And you said that you want to maximize the money that's in a compensation plan at an expeditious rate. Then I go into the Power 6. I've had several people, just because we put it out there, that really successful people that have raised their hand and says, I can do this. And it's very refreshing because, we've been talking about this all along, but of course, I just recently did the recording. So I really want to encourage you all to use that recording because it is working for some people. And if anybody, as we go through this presentation, tonight, feel free to raise your hand and say, yeah, I'm doing it. But what I want to do right now, you guys, because this is not going to be a long call, I want to make sure that we have time to recognize some people that have been hitting some ranks within the last month. And I know and I don't know all of the people on here that have some people they want to recognize, but I know Gwen Millsap has had some success within the last couple of weeks. Miss Millsap, would you please come on and recognize the people that you've had on your team that have recently hit some ranks so we can recognize them?
Hey, Verdita, good evening. I'm loving this. This is awesome. This is awesome. And I'm getting it. The Power 6, I'm getting it. We're going that way. Okay. But I do want to recognize Dr. Israel Spalding. He's went manager in 30 days. And also his new brand partner that he sponsored is Jamie Fortner, who went manager in 11 days. So I want to congratulate them tonight.
Thank you so much, Gwen. And I know that you got some powerhouses that you're working with. Congratulations on all your efforts. Also, I want to ask Mr. Wendell Tomlin and Renee Tomlin, you all have been doing some incredible work. We saw you all last week up there in Virginia. And I know you all got some people that are really, really motivated. Are you on the call? There they go. Can you come on and let us know all these people that you recently had promoted?
But before I go any further recognize them, I want to say, you all, listen, Bradita, Monk, Harvey, Monk, y'all are the greatest. I mean, just come with me and share your knowledge with us is just great. So I want you all to know that, hey, listen, they're available for you, and they came here and we had a fantastic time, I'm telling you. But anyway, make a long story short, we did have a lot of people come in, you know, to raise up to manager and to director. So we're gonna do Lona Rogers, Dr. Lona Rogers, and her husband Thomas Rogers, our director. Excuse me, I'm sorry, they're directors now. Joseph Tapper and Janice Tapper, they're directors right now. I'm talking about it, but then we're talking record time here. It's just amazing how many people. Janet Murphy is a manager now. I mean, we talking record time. So I'm just so excited. Zelda and Adrian, managers. What I'm saying, they're coming here, and we all bought into the Power of Six. We know and we understand, and didn't have leadership like Vidita and Harvey Monk to come in. It makes you really look at yourself, you know. So can you do it? Yes, yes, you can, and yes, we can. So I want you all to know that we're excited about it. We keep the momentum going. We want to make sure we go get it fast and put ourselves in position. Because let's face it, that's what the Lord wants you to do, is put yourself in a position to receive your blessing. Why? Because you got the coat of blessing on you. Don't take that coat off. Leave that coat of the blessing on you. These people who are graduated, matter of fact, Joseph Tapper has his son that's graduated. Acknowledge him. He's a manager now. So what I'm saying is catching on fire. Keep the excitement going because everybody wins. Amen.
What about Alvin Jones? Is he one of the managers as well?
Jones became a manager. Yes, recently.
Okay.
Alvin Jones just became a manager. Yes.
Yeah, so you all are doing some things, you know, one thing I will say I like about Wendell and Renee, they, every single day, they're either going and doing a one-on-one, you know, onboarding to a new person, or they did a meeting today, right before this call.
Yeah.
They'll get on the road and go different places. And, you know, for those of you all don't know Wendell a year ago, I mean, if you don't know his story, I'm just sharing this for the people who don't know. He had 3 strokes over a period of 14 years and all kind of medications that didn't work. But, you know, to be able and willing to get out there and work every single day, travel, whatever they have to do, that is impressive. And many people are way more, you know, in better condition than you are, because I know you're not completely healed, but you're a whole lot better than what you used to do, B. So congratulations on all y'all success, and we know that you deserve it. Let's see who else. We've got some other people. I know Jeffrey Payton, boy, you are killing it out there. Come on, Jeffrey, and share your success with your team.
More than happy to, actually, and thank you, Verdita, for allowing me to promote these folks. I mean, this is probably one of the most effective, short and to the point, and effective Power of Sixes that I've had the pleasure of being on. I mean, the information that you just shared with the professor, with the congruency and that being in alignment. You know, I learned something quickly tonight, but I got to tell you, all of that works in conjunction with these 3 people that I want to promote tonight. These folks hit manager last week, all 3 of them, and they hit within the first 30 days of their being. One gentleman hit after he upgraded from advanced to premium. He literally just took off from there. But the first person I want to literally promote, this gentleman's a car salesman here in Atlanta, does really, really well, already successful. Mr. Steve Parker hit manager last week. Another person out of she is out of Flint, Michigan. Her name is Donna Fair. I mean, she hit the ground running, hit manager within the first 30 days. And by the way, this next gentleman that I want to talk about, whose name it goes without mention, his name is Mr. Keith Henderson. This guy has has literally taken this bull by the horn, and he's the gentleman who upgraded a couple weeks ago, and then literally got busy going with his stripes to get to manager. But prior to that, he was just simply, acquiring customers, which he's got quite a few of those as well. But each one of these individuals have caught the momentum. They've maintained this I don't want to call it mindset, because I don't want people to get stuck or set on a certain mind level. They've expanded their minds to the level now where they can see director, they can see senior director, and all the way up to SPD. And you, Verdita, are a complete inspiration for them. They're all on this line right now, but I'm super excited for you to allow me to mention their names to the entire Zoom, and believe me, you're going to hear a lot more from those people as well. Keith Henderson especially. I put him up there because this guy is a real builder. You know what I mean? He got the information, and after he turned the information over in his mind, he literally digested, and now he's soon going to be doing presentations for himself. But his organization is now spanning from Phoenix, Arizona to Los Angeles, California. The guy's doing a great job, and the rest, so is the rest of the team too. But that's just to name a few. I've got some other folks that are really creeping up on hitting their first rank, like Deborah Cumberbatch, on her way to manager. Izelma Booker, just this close to director. She may even hit by this weekend. There's just a whole slew of leaders that thank God have fallen into our laps. And Wendell said it best. You pray over this entire opportunity. You believe God for this entire opportunity, and that means paying attention to details. Are unfolded to you, manifest your growth, manifest your prosperity, manifest everything that you've dreamed about in your life. And I believe that all your dreams can come true through this company. Thank you, Verdita.
Well, thank you, Jeffrey. And you know what? All of this is a reflection of you and your wife's leadership, your Regina's leadership, because I observe you from afar, and you're just a powerful energy and very positive, and I really appreciate everything you do for this team and all the inspiration. I'm also so happy that your whole life has changed because of this patch, and so you just keep it up. And we're gonna be all
So
at the
much.
top. I'm telling y'all, you may not be where you want to be right now, but if you just hang on, we're gonna all be at the very, very top. I'm gonna take a chance. I know, first of all, I know Monique Dotson, they had an incredible, Monique, if you're available, do you mind coming on and sharing the success? You all had something very, very special. Was it this past weekend? Can you come on and share that? Monique,
Hello, can you hear me, Verdita?
I certainly can.
Okay, wonderful. Sorry, I cannot turn my camera on right now. Not able to, but we did have a very successful event this past Saturday. It was called, what we titled it, was an all women's event this time. It titled it Empower Her with LifeWave. And what we did is we focused on mental health and wellness. And we just spoke about anxiety and depression. And then we just went into all kind of different health related concerns that women talked about with menopause and different testimonials. It was really nice. We're looking forward to doing the next one. We did it a little different. We kind of, than our regular presentations. We did the full presentation as far as what X39 and LifeWave, David Smith, but we allowed women to, does anyone have any testimonies? And they just kept coming and coming and coming. And we were like, wow, we were so excited. So having a theme related type of presentation may be very encouraging for some of you. I was sharing this with some of the men. They may want to have an Empower Him, where they talk about things that are relatable to men, not to that we're going to be separated all the time, but it was really something that we wanted to do like a pilot or a trial just to see how much participation we would receive. And it was really, really very successful. So that's
Yeah.
just one of the events that we're going to do. We have a lot of things coming up in Houston where we're just, like you said, we just want to keep this thing moving because we're blessing a lot of people. I wanted to just share this. This might be a good idea for someone that I was thinking about. I was just looking at how AI technology is moving a lot faster as far as jobs that is causing people to lose jobs based on this technology. And there were a couple of articles that I read about. So I was thinking about just, I was sharing with people how they want to be more proactive than reactive. And this is the time where we need to uh, continue to use our amazing health and wellness light therapy technology and use this as a resource, not only to feel better and to be better, but it's time to use this as a resource because we need to save money. What are you going to do when these certain technologies are taking over, a lot of jobs for oneself and their loved ones. So that's something we're touching base on as well. But thank you for allowing me to share, Verdita.
Thank you for doing that event, Monique. I hear it was awesome. I did get a chance to speak with Jessica earlier, one of the directors on your team, and she said that she had enrolled 4 people at that event. That's pretty good. So
Yes,
I'm glad
yes.
you all had a great turnout, and just keep up the good work. I'm going to take a chance on seeing if this individual is on the call. I see Joseph Tapper on the call, and I'm not sure if his wife is nearby. But the reason I wanted to see if it was possible that she was nearby, because when we were in Virginia, we did this training at this library, and Wendell said, we've got to get Joseph Tapper and his wife, she's a doctor, we got to get them on a Zoom. So in my mind, I'm thinking they want to do a Zoom presentation, but that was not the purpose of the Zoom. The purpose was to really have her enlighten us for the people in the room. So before I tell what she did, I want to see Joseph. Is your wife available to come on in? Because I just want to ask her a question. I want to empower the people that are on the call.
Hi, Verdita. Dr. Janice is here.
Hi,
How are
Dr.
you?
Janice. How are you?
I'm fine. How are you this evening?
Good. Listen, would you do me a favor and tell the people on the call what kind of work you do with regards to stem cells and why you feel that this patch is so amazing? So y'all listen, because this is going to bless you what she's going to say.
Yes, thank you. I coincidentally work in stem cell transplant. I take care of patients who have blood cancers. And although that's my full-time job, I work for a big corporation. They pay me very well. I'm more for the patch opposed to what we're doing at the hospital. Now and again, these patients have blood cancers. If you're all not familiar with them, is leukemia, lymphoma, myelodysplastic, aplastic anemia, etc. So what we do there is patients, in order to heal them, they have to go through chemotherapy, and the chemotherapy is in preparation for the stem cell transplant. So what happens, depending upon your disease process, you're qualified to get what we call an autologous stem cell transplant. And when you say autologous, the word auto means it comes from you. We take your stem cells, send them to a lab outside the hospital. They genetically modify your stem cells to go back into your system. So, for example, people who have multiple myeloma, which is cancer of the bone, basically, those patients are qualify for that type of stem cell transplant. And then we have those who get the allogenic transplant. Those are the people who qualify for getting a transplant stem cells donated to them, whether it's from their family members, their children, mother, father, etc., or someone that they don't even know that be coming from another country. So what happens, I see it over and over and over again. It's just a sad sort of thing to see because these people get these transplants and they're constantly, it's just a revolving door. I see them in and out of the hospital over and over and over because unfortunately they reject the stem cells that they're getting, especially from someone that's not, we call it an unrelated matched donor because it has nothing to do with them being related to their family. These people get sick. They get what we call graft versus host disease, and whatever that person has that donated the stem cells, whether it's heart disease, lung disease, kidney disease, etc. These people who get in their stem cells, they end up getting these same type of diseases, and that's what we call GVHD, graft versus host disease. They pick up these diseases from these people that donate their stem cells to them, and they become sick, and it's just a constant, like I said, revolving door. They come in, we have to manage their symptoms, whatever they be, maybe nausea, vomiting, diarrhea, I can't eat, so and so and so and so. And I tell you what, I had a patient just the other day. She was discharged on Friday. The minute these people get a fever because of their immune system is so weakened, the minute they get a fever, they have to turn around and come right back to the hospital. Patient was discharged Friday. I was on in the hospital on call. I work a seven night work week. And I was on call, so she called. I answered the phone, and she said, "Oh, Dr. Tapper," well, they called me Janice at work. But Janice, I have a temperature. I just was discharged yesterday. I said, "Ma'am, I know, I understand, but you already know when you get a temperature, you have to come in because they have no immune system. They can get sick and literally die because they have nothing to fight with." So this is why the patch, I'm all about the patch because this is our own stem cells healing us. It's no medication. We don't have to worry about side effects. We don't have to worry about picking up diseases from like viruses. Communicable diseases and viruses. I wouldn't necessarily call them diseases, but some of them are worded diseases. But things like viruses and funguses and bacteria that these people have, these people are so sick they can pick it up so easily. And it's unfortunately, it's sad. I love what I do, but this is not what I signed up for. So I'm more into natural medicine. And I'm just going to tell you, I've been in my field for like 28 years. And back in 2012, I had my own primary care practice. I was your typical primary care provider, and I was working with the internal medicine doctor. He's from Congo, Africa, and I loved working with Dr. Pecky because he's all about natural medicine and healing from going out in the woods, getting bark and limbs and things like that to heal you naturally. So I'm all about the stem cell patch. I'm not going to go on and on and on because I can talk all
No,
night.
but we're loving this, but I guess what I also, so really quickly, because I know you said you didn't want to go on and on, but you were saying that you did your own research before you believed the way you believe now.
Oh, most definitely. I was very reluctant because I'm a reader. I'm used to researching, and I had to go through several courses of research, and we call peer reviewed articles, just like Dr. David Schmidt. All these articles and patents that he has gone through and put out there, they're reviewed by peers, scientists, researchers, doctors, and so forth before they say, okay, we believe this product worked. And that's how I approached it when it was introduced to us. And I told Joseph, I was like, not that I was skeptical, but like I said, I'm a reader, I'm an investigator, I'm a researcher. I have to read and understand that
And you
this is
should,
something.
and you should, being
Yes,
a physician, you putting your
yes,
stamp on it.
exactly. And
And
that's what
so
I did.
and so now what I want to say, because you're a busy person, you and your husband is a busy person, you and your husband well, your husband said that you all want to maximize your time as well as maximize it, get to the big money here. So you all
Yes.
are about to introduce this to some power players, right?
Yes, definitely, definitely. We have some people on board that are working hard. I mean, we've signed up people. It didn't take long, like within a week, if that long. I mean, people are on board, because I'm educating people. I'm giving free consultations. I can't give any medical advice, but I'm giving free consultations, to discuss what your needs are and kind of help you see what's going on. But this stem cell patches, it's nothing out there like this in modern medicine, and it's helping people. And let me just briefly tell you my story. I'm healthy. I don't have any health conditions. I have asthma from childhood, but no big deal, well controlled. But I did fall from my chair, and Joseph swear up and down he didn't push me. I went to slide my chair up under my computer desk here at home, and it has wheels, and the chair slid from under me, so I fell right onto my bottom, and that caused my lumbar spine, which is your lower back, just to shift just a little bit, and we call it an anterior listhesis. And the higher the grade, the worse the condition is. So I have a grade 1, which is no big deal. Like I said, my spine shifted, and I was feeling it in my hip a little bit. And let me tell you, folks, I was whining and moving my hips around, trying to find the pain, couldn't find it. Renee and Wendell, when we met them, Renee took me in the bathroom. A matter of fact, I was up in Richmond, Virginia, doing a contract. Outside of my stem cell transplant, I do trauma surgery on the side as well. So that's when I was up there working in Richmond, Virginia, when I met Renee and Wendell. Renee took me in the bathroom. She patched me and put the patch on my back and so forth, the Life Wave. And so I'm at work and I'm moving around. Like I said, we had a couple of traumas coming in, and we moving. I'm slapping in chest tubes and doing all the things that I do in the emergency room. And I was like, this stuff is amazing. But of course, I did my research first. And so that's what I've been taking the patch for my back pain. But let me tell you something. In 2016, I had bilateral bunionectomy, and I had some keloids on my big toes. And I tell you what, I always tell people, expect the unexpected with this patch, because I wasn't, no longer looking at my toes and the keloids. I knew they were there, whatever. But now I tell you, those keloids has flattened. I don't even see the scar anymore. It's gotten so where it has just kind of blended in with my skin tone. So expect the unexpected with this patch. And like I said, I can go on and on because my juices are flowing. That's the mental clarity you'll get with this X39 as well.
Wow.
Your juices are flowing, and your mind is just like, and me, like I said, I'm a teacher, I'm a researcher, I'm a learner, and I love to share with people. But this X39, like I said, is nothing out there like this in modern medicine. And I'm all about it and willing to help anyone.
Wow. Well, we really appreciate you coming on here and sharing your knowledge with us. I mean, this is
Sure.
people just listen. Here's a qualified physician swearing by this patch, and she's saying all the reasons why you're going to be concerned if well, people get the stem cell transplant because they don't have any other recourse. Is that correct? Dr. Tapper, they get they get the transplant
Uh-huh.
because they don't really have any other options, right?
That is correct, and it's extremely expensive. And when I say expensive, it can be anywhere from $10,000 to $15,000. And it doesn't mean that person's getting chemotherapy every day. But for the most part, these people are in the hospital for 30 days at minimum. And yeah, they getting chemo like maybe 2 weeks straight, get a week off, a little rest period, and so forth and so forth. But it's a very expensive, and I wish I could slap a patch on them. But like I said, I work for a big healthcare
Yeah.
system, and that would go against what I do. But outside the hospital, this is my virtual practice and this is what I do. And I'm all about the passion.
Wow,
Anybody
awesome.
needs me and have any questions or
Yeah,
just
does
some,
anybody have any questions right now while we have Dr. Tapper on the line? Any quick questions for her? Unmute yourself if you do.
I have a question, Dr. Tapper. Thank you. This is Monique Dotson, and oh my goodness, a lot of information you just shared. When they're getting the stem cell transplant, you named a few side effects. Can you name those once again, please?
yeah, the most common side effects people get are nausea, vomiting, diarrhea, poor appetite. And another thing is mucositis. And that happens, what happens with mucositis, they pretty much get sores in their mouth. And it starts from the mouth all the way down to the gut. They can get sores in their mouth, sore throat, where they can't even eat and drink. And then we have to put them on what we call total parental nutrition, where we're giving them nutritional intake through an IV or through a central line. So it's a lot of side effects. And so basically, that's what I'm there doing at night, managing their symptoms and, of course, pain control. During the day shift, my colleagues, they're prescribing the chemotherapy, but because I work the night shift, I run the whole entire unit, 32-bed unit, and sometime off the unit in ICU and blah, blah, blah. I'm managing all these symptoms of pain and nausea, vomiting, diarrhea, most common, and the mucositis, not being able to eat and drink. And this can go on for a few days when they're not able to eat and drink until we get to the point, okay, they're losing pounds. They're not having the correct caloric intake. We have to put them on feeding tubes and stuff like that,
Wow.
or in the IV. Yeah, it's some serious stuff. And
Well, we have so many doctors, I didn't mean to interrupt you, but we do have so many physicians that, I mean, anywhere from, neurosurgeons and all kinds of doctors that are part of LifeWave, just because of
yes.
how phenomenal this technology is and how they can really help some people. So, and this can definitely replace your income, even though I'm pretty sure you're making a lot of money with your job. This opportunity, especially because of your credibility, you're going to attract certain kinds of people and it's going to go a long way. So thank you for being part of our team and catching the vision.
Definitely, most definitely. I'm happy to be here.
All right. Any other questions for Dr. Tapper really quickly? All right. Well, we know that you're around, so if we ever, have any specific questions, we'll make sure we reach out to you. But looks like Sydney Laster has unmuted themselves.
Okay, thank you.
I was thinking about it, what she was saying, because one of my friends' wife has leukemia. And so that's why it was very, very informative to me, the testimonial that you gave,
Yes.
because I have something else to talk to them about tomorrow.
Yeah, well, how is she doing?
Well, she's having some of the problems that you indicated, her
Mm-hmm.
immune system. And the problem was she had cancer twice. She had it 2 years ago, breast cancer, then she had a pancreatic cancer. And because
And
she
let me just give
because she had
you.
to- okay.
Go ahead. I'm sorry. I didn't mean to cut you off. Let me tell you something that's important that people might not realize. We call it treatment-related leukemia. I'm not sure if this is what's happening with your.
That's what I was gonna say. That's what it ended up. She ended up getting leukemia as a result of the chemo that they gave her over time.
Exactly.
Chemo was causing so many problems in her body. Tried to get them to use the patch. But I said, hey, you want to use the doctor, go ahead and continue to use the doctor. But every time she got chemotherapy, it affected her legs. Her legs got, rashes on them. She's always itching because it affected the insides. And so
Right.
it's a
And that's
terrible
probably the
thing.
disease process, the leukemia. They get those leukemic rashes. But like I said, I'm not recommending anything. I'm not giving any medical advice, but those patients who are on chemotherapy, it is advised that they don't use the patch during the periods of when they get in their chemotherapy, is when they get that break from chemotherapy, whether it be a week or two or whatever, that they could use the patch at that time.
Well, they want her to continue with chemo for the rest of her life, and you know, it's terrible situation. And the
Yeah,
bad
I
part
understand.
But
about
what
it,
she's saying is that saying that what Dr. Tapper is saying is that it's not that they can't use the patch. They just don't, let's say, for example, you're getting chemo this week. You don't want to use the patch during that week. But
Correct.
once this week is over with, now you can wear the patch until your next treatment,
I
if
understand,
they're willing.
but
if
I'm
they're
thinking
willing.
that she's on a pill every day,
Oh, that sound like venetoclax.
right? She's on a pill,
Oh, okay.
Yeah,
and
yeah,
so that's the
okay,
bad part about the situation that she has.
yeah.
You know, concerning the patch.
Okay, yeah, I understand, yeah.
Yeah. Well, listen, we appreciate all this information, Dr. Tapper, and
You're
we
quite
appreciate
welcome.
you being on the team. And if, if anyone has any specific issues and they, I don't know, just need some advice or something, we'll definitely, reach out to you. And so I appreciate your time this
No
evening.
problem. I'm all about educating people about their health. That's
Awesome.
yes.
So you guys, you see, this was a blessing tonight. We started out talking about one thing and God led us to another direction. And so we are so blessed to have everybody on this team always contributing. There's always someone contributing information. And Dr. Tapper, I can't wait to do your Power 6 call this weekend. And we know
Oh, definitely.
y'all already director. Y'all are going to be on your way to senior director.
Nice. That's
All right. Well, listen.
awesome.
Anybody else have anything they want to contribute this evening before we end the call?
Is Dr. Tapper married?
Yes.
Sounded like my husband. If you
Yeah,
don't get in here, it's gonna
Joseph
be a
Tapper, how are
divorce.
you this evening, Joseph?
I'm doing real good.
Yeah, Joseph was the one that got you all to director. He's the one who's doing
Yes.
all the work in the background.
Yes.
I struggled to get her on board.
She
She
don't struggle.
had to protect her license. She had to do her research. I
Yeah.
was all motivated until one day I got a call from her at work. She said, "This is my calling."
Yes, yes. Yeah, because like I said, I was doing an internal medicine doctor from Congo, Africa, turned me on to natural medicine. And it was like this is how our office ran. He was more into the natural medicine, recommending vitamins and so forth and so forth. And I was writing the prescriptions for the high blood pressure, diabetes, high cholesterol, et cetera, et cetera, et cetera. And I was like, well, wait a minute, I want to get on board with these vitamins and stuff and, do it the natural way. So he taught me a whole lot that they don't teach us while we're in school. You learn this by meeting people and being introduced to certain people. And, you have your calling for which direction you want to go.
Well, I'm glad you see this as your calling. Well, listen, you guys, thank you so much for everything. Thank you for being on the call tonight. It is recorded and I will be sending it out. You all have a wonderful 4th of July weekend and we'll see you next week.
Thank you. And you all do the same.
Thank you.
Thank you.
Good night.
Bye.
Thank you very much.